now, before we have up our next speaker. What you got, Becky? Okay, this one is for the Nature's Garden delivery, the certificate to have the box of veggies and fruit delivered. All righty, ready? Got them out? Everybody got your tickets? 275-243.
You should scream.
Nobody? Oh, oh, just because he's got like 10 to check. Great job. Congratulations. And, this is from DeRosa Medical. Watch this. A man's going to win this one. You watch. This is to have your forehead done. But this is valued, it's actually the Botox, right, for the forehead, valued at $400 through DeRosa Medical. Hang on. Here we go. You ready? Here's the number, 275160. All right, Shayla. Shayla Blackburn. Woo! Are you ready, Mark, yet? Okay, let's do one more then. We'll do Envita's. Where's Envita's? Okay, got it. We'll do one more. Yeah, this is the Envita gift basket, which will also include a personalized medical review. And you'll get to taste, just so you know, Envita has a table set up there that you can taste their greens. You're going to hear from Dr. Dino next, but this is their gift basket. But this will also include the first appointment for the Envita Medical Center too, so you can check. So this is valued at about $400 for this package as well, and with the doctor's visit. So this is number 275166. Who's me? All right. There we go. Do you need one more, Mark? Are you ready? You're all ready? Okay, we'll do the last one. Which is a big gift basket of all the products from DeRosa Medical, which is valued about $500 for that gift basket. So we'll have that up here as soon as Dino's done. But you're going to hear from now the founder of the Envita Medical Center, who is not only changing the face of naturopathic medicine, but when you staff your staff with MDs, DOs, the nursing staff, the staff that they have are amazing. And what they do for you, for your body, for your health, it's personalized. And they listen and they find out what's going on so that they can correct it. So I think he's a genius. Most people who meet him, he's very wise, but he's passionate about what he does, and he wants to change the face of medicine, and I think he's doing a darn good job. And we're very fortunate to have him here tonight because he's a very, very busy doctor. So please help me welcome Dino Prato.
Hi. I think Mark's going to be my clicker because it's not connected to the computer. Thanks for coming out on what is it today? Tuesday, Wednesday, Friday? Which day? They're all blending together. And for all I didn't even know you guys were all coming, but there's a whole staff back there. Stand up because they came. That's very good. Good to see you. These are the real, wonderful people in our office that do great work and take good care of the patients. Dr. DeRosa did a wonderful job, real right to the point, and just as she was saying, if you really want to see your age, your biological or chronological age, you've got to get your hormones in order. And one of the amazing things is we were just chatting over there how much the pharmaceutical companies played a role in really the suppressing of hormone balancing. It's now becoming more popular, and if you live in Scottsdale or Beverly Hills, and all, you're going to get your hormones balanced. But it's going to become more and more popular as it moves through the mainstream. It's true because everybody talks. There's a word of mouth component to it. I'm going to address a few things tonight, and I have to give my legal disclaimer before I start. I'm not licensed to practice medicine in the state of Arizona. I'm licensed in Montana, Vermont, and Hawaii, so I cannot give you prescriptive or advice in treating your condition. As you can see, I have many regulatory agencies on my back, so I have to spot out my disclaimers. But nonetheless, we're here working. We have 3 sections to our clinic before I begin this presentation. We have Envita Medical Centers here in Arizona, which is to treat chronic and difficult diseases. That's what we do. We have a section of Envita Family Medicine, which is wellness care and taking care of patients' care. And then we have Envita Medical Centers of Mexico, which is where we do our real high-tech technology, from cancer cell vaccines to using light in a surgical way, like photodynamic surgery. We use really high-tech, type technology to work with cancer and chronic disease patients. So kind of gives you guys an idea. We're in the broad spectrum of things. So before I get started tonight, how many of you, just so I know your interest, because I'll build the talk right on what you need, okay? How many of you here are interested in cancer in particular? Cancer, okay. How many people in here are interested in heart disease and diabetes? Okay. And then how many people in here are just interested in general wellness? That's everybody. Okay. This gives me an idea. Believe it or not, as we go, their audiences are different, so I want to address it for to each audience. What we're going to do is, you can turn the slide. This is unlocking the key to chronic disease, because right now these are the 3 big killers: it's heart disease, cancer, and diabetes. We look here at cancers. We talked about, she just listed all the infections. Most cancers have an infectious disease origin. We were just talking a minute ago, what percent of cancers are genetic? Less than 5% genes. So you can throw that out. That's very rare. And most of the genetic problems that we think are genetic are coming from excess hormones, like xenobiotics and xenoestrogens that are in the water, that are in the sometimes foods we eat and toxins in our environment. We know that, right? Some of you guys have heard this before. The infections we can clearly link them. And here's what happens. Anytime you come around a carcinogen, whether it's an infectious disease agent or a toxin, it's an epigenetic shift that occurs. So our genetics, we're not born with our genetics and we're stuck with our genetics. Our genetics can change every 30 to 60 days. The telomeres in our DNA can shift based on what is surrounding us, right? So if we have infectious diseases, if we have toxins, if we have these problems, our genetic shifts can occur in such a way that we have a mutation and a cancer can develop. So this idea that you're born with genes and you're stuck with them is nonsense. And this is true about the hormone component as well. If it's missing, if it's low, you're going to have epigenetic shifts because of the changes in those things inside the environment of the body. Does that make sense? I mean, it's common sense, right? I'm not sure. Now, this work a guy who did a lot of this work was Dean Ornish out of UCLA. Dr. Ornish did all this work on epigenetics, and you can start researching more about this online. But where epigenetics in the future is really related to infectious disease. Can we switch the slide? I'm going to kind of move a little bit. So look at cardiovascular disease. Is it related to infections? I just gave you the list of infections with heart disease or with cancer. Now you have a whole list that are related to cardiovascular disease. One of 17 genetic clotting disorders that occur in the bloodstream are due to infectious disease. That means when the infection is present, you begin to have shifts that cause clotting disorders, infection. So you don't think about that, but that's a big, big factor. So go ahead, we'll turn the thing. Here's coagulation problems. Look from the right to the left, you can see here is just a simple coagulation study that you can do under actually a dark field microscope, and you can look at in the far right, you can see the cells are separated, right? In the middle, they're a little bit more clotted and thick, and to the far left, they're really in a roulet formation. They're all stuck together. They're agglutinated. What causes that to happen within the cells? Well, really, in summary, let me just share this with you. Infection can cause this problem, right? Also, oxygenation issues can cause this problem. We can go on and on. Chemicals, toxins, all these different things are going to impact that. For some of you who do basic understanding in alternative medicine, over here is alkaline. Over here is more acidic, relative, right, in the bloodstream, based on diet, nutrition, right, these kinds of things. Go ahead. Okay, so I'm going to move through this slide because I don't have a lot of time, but here you have a really nice little clotting picture. Do you see that web that goes over the red blood cells like that? These are like electron micrographs of clotting. When I see things like this, I just have to say I'm blown away how God made us wonderful and amazing, because that's such a blown up picture. It's miraculous. Even for doctors, when you're working with patients, it's miraculous, the things that are going on in our body that we really still don't have a clue of. There's only about 13% of the infections that we're aware of throughout the world. You can go ahead and change it. So we look at all these autoimmune diseases. How many people in here have fatigue? Okay. Fatigue. Yes, you could have hormone deficiency. Yes, you could have poor dietary health. Yes, you could have a lot of stress in your life. Yes, you could be dealing with chronic infections. How many of you have pain? See, all these are simple questions. Don't raise your hand. How many of you have foggy thoughts and memory, right? See, all these, when you look at integrative medicine, you can do a history of this and say, oh, you have a deficiency of this. Oh, you have a deficiency of a hormone. You have a deficiency of a nutrition item. You might be deficient in this vitamin. You may have a problem of this toxin. But where do you find out all of this information so it's not just tailored to one specific thing? Does that make sense? You do that by doing a full evaluation of your body and understanding what your risks are, what your risks are to chronic disease, where you stand in chronic disease, and how to reverse that. That's what we've been doing for the last 12 years. That takes a lot of work because there's a lot of questions you have to ask. Most of these patients here